Everybody. I'm Genevieve Srinivasan. I'm the program director of the Emory General Surgery Residency. We want to thank you for joining us tonight. I am going to do a little bit of a presentation about the program in just a minute here, but before that, I want to introduce all the faculty who are on the call tonight, and then after that introduction, just have our chairman, Dr. Sweeney, give you a few opening remarks. So with us tonight, we've got several folks who are an important part of the leadership in our residency program. We have our immediate past program director, Dr. Keith Delman, who's a professor of surgery in the Division of Surgical Oncology. He's also our associate chair, and the interim division head down at Grady. We have Dr. Ravi Rajani, our associate program director, and he's in the Division of Vascular Surgery, and situated down at Grady, and a really important part of the education down there. Dr. Michael Lowe, who's in our Division of Surgical Oncology and our Director of Extramural Studies, specifically related to extramural research. Dr. Olamide Alabi, who's in the Division of Vascular Surgery and intimately involved with resident and medical student education. Dr. Josh Weiner, who's in the Division of Surgical Oncology and the Associate Clerkship Director for the medical students. Dr. Jonathan Mizell, who's in the Division of Pediatric Surgery and also very heavily involved in running the M4 surgery rotations. And then Dr. Alfred Shaheen, who's in our Division of Pediatric Surgery and our Vice Chair of Surgical Education. We also have a number of our residents on the line who I'm not necessarily going to introduce by name, but including Caitlin Fitzgerald, who's our Administrative Chief Resident this year. And then Dr. Sweeney, if you wouldn't mind giving some opening remarks before I go into the slides, that would be great.
Thanks, Genevieve. Well, so I don't want to take a whole lot of time because I really would like to reserve the time for conversation. I think that's why a lot of you have joined us, but I just want to make a few points. So first of all, welcome. You know, you're virtually with us here in Atlanta, but you know, this is a wonderful place, and you know, a place that all of us really enjoy living and working in. You know, this is a unique and special environment, we believe. You know, it's a training program that has a diversity of opportunities, and also a diversity of people. And those opportunities are, you know, really diverse training opportunities, but also research opportunities for those of you that choose to pursue that during your time here. And so all of those things that, you know, really, I think, allow us to craft a unique experience for each of you, and to have that be an individualized experience. And so, you know, we really think this is a special place. We're proud of the product that we turn out each year, and we think that you'll find it that way. And so thanks for making the time to join us tonight. And I'll shut up so that we can have more time to talk, and you can ask questions, and we can spend time doing that. So thanks, Genevieve. I'll turn this to you.
Thanks very much, boss. So just for those of you on the line joining us tonight, to give you a sense about what the evening will be like, I'm going to go into an informative slide deck that hopefully will be the launching board for a number of questions for y'all, or we'll answer questions before you ask them, perhaps. And then we have 4 different breakout rooms, and the rooms are organized by topic. So what will end up happening is we will be rotating the residents and the faculty, but they're going to stick with the same topic. And so tonight you'll be covering what it's like to live in Atlanta, questions about education and curriculum, questions about research, and then specifically questions about our specialties. So we have a number of faculty who are in different specialties who will be kind of sticking with that one topic. In addition, when we switch rooms, Marianne, our illustrious program coordinator, is going to actually be moving the faculty and residents from room to room. So you as medical students will be staying in the same room, but she'll give a little flash warning that hopefully lets you know when the session is about to wrap up and when people are going to be moved. So without further ado, I'm going to go ahead and share my screen to go through some information with y'all. All right, so I want to talk to everyone a little bit about the clinical experience at Emory and hopefully give you a sense about what our campuses are like, starting off with some factoids about our residency and where we're from. So you'll notice that the vast majority, well, a large chunk of our trainees are from the Southeast, having grown up in the Southeast and then attending both undergraduate and medical school here. But we have people internationally from all over the country, and we certainly welcome people from all over the country. This is sort of in keeping with the way a lot of training works, that people tend to stay regionally no matter what. Just in terms of some numbers, in terms of the number of residents we have doing research, we have 10 categorical residents a year. That number fluctuates between different PGY years because we are a flexible program. So some residents choose to go out into the lab after their second year. Some residents choose to remain clinical for their 5 years. And so that changes where our numbers may be in any given year. You'll notice that at any given time, we have anywhere between, about 20%, 20 to 25% of the residents in research. And in recent years, the vast majority of the trainees have chosen to go into fellowship. That doesn't mean that they don't pursue careers in general surgery. Fellowship does include minimally invasive surgery and acute care and critical care and trauma. But we do have a lot of our trainees who make that decision. We've also had trainees who've made the decision to go directly into practice. And starting last year, we started a single track. So the 10th slot in our category amongst our categorical residents is for a trainee who plans to pursue rural surgery for the most part. And so we're always looking for a candidate who wants to pursue that career towards delivering care to the underserved populations. You've got a great comprehensive clinical experience. We have a wide variety of hospitals, including private practice experience and large academic experiences. And I'm going to go through those one by one. We've got very comprehensive specialty exposure. I don't think you'll find a program in the country that has a more broad group of people and specialties to expose you to. If there's something that you're interested in learning about and training in, we have it here at Emory. And we have a very diverse patient population. So where do our trainees rotate? I'll go to the first hospital. Emory University Hospital is a 750-bed hospital with over 24,000 annual admissions. It's where the residents will spend roughly 40% of their time as trainees in 4 to 6 months per year. And you'll note the several rotations that go through here, primarily general and acute care surgery, minimally invasive surgery, colorectal, HPV transplant, what we call the BME service, as you see listed there, vascular, thoracic, plastics, and urology. Grady Memorial Hospital is a 970-bed academic safety net hospital. It is one of the most preeminent academic safety net hospitals in the country. It's a level 1 trauma center and one of the top 5 busiest burn centers. And we have several rotations situated there as well, including general surgery. This is where the trauma experience occurs: burns, vascular, SICU, plastics, and urology. And trainees will spend anywhere between 2 and 6 months per year. More in your senior years, there's slightly less of the Grady experience than in the junior years, but in general, most residents are there for at least a few months a year. We have Emory Midtown Hospital, which is ever expanding in size. They are currently building a really lovely cancer-based wing of the Winship Center. We have surgical oncology, general and bariatric surgery situated there, with residents spending a few months there a year. Children's Healthcare of Atlanta, which is really a preeminent and clinically exceedingly busy children's hospital. It's a 260-bed hospital. It's one of the top 10 pediatric specialty hospitals in the country. The residents who rotate there are primarily in their first year and the 4th year. St. Joseph's Hospital, which again has many of the same rotations as we have down at Emory Midtown. It's ranked number 2 in Atlanta and Georgia. We have, again, as I mentioned, surgical oncology, general surgery, and vascular surgery there. Starting next year, we will be having a regular rotation at Emory Johns Creek in colorectal, breast, and endoscopy, and a senior colorectal surgery elective that we've had there actually for the last number of years. This experience is intended to be very much a community experience and to mirror some private practice experiences. The Atlanta VA, which is a 466-bed hospital, where general and vascular surgery is done. Again, the residents who rotate there are primarily in their second and fourth year. And finally, Piedmont Hospital, which for a long time has been our private practice experience as we've expanded through the Emory systems. As I alluded to, we have other campuses where our residents get that experience. And this will actually be the last year we have Piedmont as one of our rotations.